Now, when you make a good point there with respect to scissoring of the leg, what patient would you scissor a leg versus the up and out like we have here?
I pretty much do up and out. The only way, mainly the times I do the scissoring is if the bed isn't available, then I'll suck
Okay.
up and do the scissoring. Yeah.
Okay.
I find for most people, you can externally rotate the leg out of the way to get a good enough position.
Okay. Now, what you talked about one really critical point about the residents do the up and away leg and too much flexion. What else should they be thinking about when they position a patient for a femoral neck fracture that they're going to treat? And we'll talk about treatment in a bit.
So another important part is getting the affected arm out of the way. So you want to put that across the chest. It's not as big of a deal for when you're doing screws, cannulated screws, because the direction of your hand, you're standing at the bottom of the bed. But let's say if you're doing a nail, when you're
Right.
doing a nail, you really want to make sure that affected arm that you're putting up and across isn't in the way of you trying to ream that femur. So that's another thing I see where the arm isn't on the chest, the elbows falling out and
Mm,
hitting you in the way as you're trying to ream or put your starting K wire in. So
right.
that's another thing to make sure that arm is out of the way. Make sure they don't have the bear hugger on and blowing out and all this other stuff in your way that you can't adduct your hand to get the
Right.
starting K wire appropriately positioned.